like to take a little slow pressure because you might get a pop. Take a deep breath in, let it all out. And with that friction, what that creates with the breath, it helps loosen up that stretch of muscle. And then right along the spine, right at the scapula, dig my heel, or you can see it right here. Just push and hold. And I try to get my pinky ring finger on top of the, what is that, the supraspinatus, and then thumb right along, right by the teres. And then take my palm and then go along the spine. Just to kind of feel where the tension is. And it kind of gives you an idea of what you're going to have to compete with and work with. You can essentially loosen this whole thing just with that, because you got the tack and stretch, and all you're doing is applying pressure. But I can tell you this side is already terrible, right up through here.
That's where you have the neuropathy, right, Lydia?
Not as bad as when we started school, but lightly, yes.
Three deep breaths. Actually, just the two is good. There we go. So I'm trying to loosen it up just with her breathing. What I like, what I like to do, especially with working non-participatory, is at least if they can breathe, what that creates is an extra pressure from the inside. So all you're doing is just sandwiching the muscle and trying to get that tension out. Okay, so right here, you can feel. I like to get right along the trochanter of where the hamstrings are. Pin that down. And I like to shake up the leg and feel right along through the IT band and right along through the calves, the gastrocs. And down here is tight on this right over here. And then right in the arch of the foot. Do a couple chops while you're shaking the hamstrings, and that should help loosen up the hamstrings. Same with the other side. Well, I guess I would just, I want you to go ahead and go through. All right, so with the legs, with any of the extremities, within about a good 2 passes, you should have an idea of what you're messing with. And right up here.
Yeah, where the thumb is, I saw the tissue.
All right. And essentially, with the general reflexology of my technique, the pinky is going to take a majority of it, because that runs all to this side. The big toe runs all to this side, and it's fairly simple. You're going to get some tightness and tension right at the top of the foot, in which you just have to make sure you cradle that, but that also affects areas right along the, that's, so right there, between here and there. And you'll feel, whenever I feel tension, it's like, okay, now where's that heading to, or where's that leading to? And you'll feel the 2 points. But I mean, you're getting your visual right now, so that'll give you an idea of what to look out for.
I see you're cradling just that middle of the dorsal line where the extensors are. Yeah.
Just a little bit of pressure, and it's loosening up, and there we go. Now this is where I'm going to start stretching across.
Mm-hmm.
So run from the heel all the way down to the pinky.
Mm-hmm.
And the first hit of tension, that's when you start up.
You're all good.
At the first inkling of any tension, that's when you start up the leg. And yep, here's her spot there. So we're gonna hold that for a little bit. And I'm probably gonna throw some rotation on the right hand, right where I am.
Yep.
Just rotate counterclockwise. And that's helping unlock the foot. Which is the weirdest thing with the body. They're like locks and keys. If you take it and you turn one way, you move the other. Right here.
Yep.
And we're gonna roll that clockwise. There we go. You okay?
Mm-hmm.
Because that snapped pretty hard.
You're good.
All right. So now down here, we're gonna go up. This isn't the problem side. I'm gonna expect a little more fight on the other. We're gonna get down to the elbow now. When you get to the elbow, pretty much I claw it so I can get all the active
So you're
muscles.
clawing the epicondyles, right?
Let's see.
Yeah.
So,
This side of the, yeah. Okay, gotcha.
And then here I got 2 on the forearm. 2
Yep.
on top.
Gotcha.
Okay, then we shake that a little bit. And we should. And I alternate between in case one affects more than the other. So I'll either move one side or I'll move the other because they bounce off of each other. There we go. And they both loosened up there. We're about done with this leg. Okay, got from there, or middle finger there. There's some tension there. And right there. I'm gonna run back up and see where we are. There, take 3 deep breaths. There we go. All right. That leg is done. All right, I'm gonna grab both sides of the knee there. All right, I'm gonna take my elbow
Yep.
and get
Right inside
right.
in that greater trochanter. Got it.
We're gonna maneuver around. Most folks will want to fight you. Just try to have them take deep breaths, or just try and tap them to kind of remind them, hey, loosen up a little
Depotement,
bit.
the little vibration depotement. I remember you doing that to me.
And then that should loosen up in the greater trochanter. Now with the elbow, I keep holding on to the ankle. I'm gonna move up a little bit and then apply lateral pressure.
Towards the sacrum. Gotcha.
Do a little more, and then up around the
Crest.
pelvic crest there. Another couple until it loosens up. That's good there. This left side's gonna be tricky. So what I'm doing, because all of the hamstring
Yeah,
is locked up.
I see it moving that way, yep.
And the calves as well. So I'm automatically, I feel all that right here.
Mm-hmm.
Actually, let me find the right bone placement, because that's not it. It's gonna be right there. Okay. And then lock the ankle in with this thumb here.
Yep.
But roll with these fingers here.
Yep.
Still doing okay?
Yes.
All right. And I'll release just enough there. Still keeping the pressure on the
Yep.
foot, because that's still tight. This is loosening up. That's still going. That's still holding on. It's getting there. And I just pivoted because it had just rolled.
Yep. Right to the head of that metatarsal.
Alright, so this is loose. We're still tight up here. Alright, it's rolling. It's rolling up here.
I see it moving down all the way.
There we go. Alright. So now, see the difference?
Yeah.
There's still a catch. Still a catch right here. Okay, so I have my
Yep.
finger thumb here on the gastroc, and then right up here. I got this again because
Yep.
right up here, I feel it all where my fingers on the top, right through there. All right, that's right there.
It's lateral, right? That's what I see at least.
Yeah.
Yeah.
And it's loosening up. It's just taking its time. All right, now keep pressure right down on the foot. We're gonna move up. Three deep breaths. You see how my hand's slowly moving upward? Because it's just releasing as she's breathing. There we go. All right. Okay, and then back at the elbow again. There we go. All right. Cool. I think it's almost done. QL's out of line. So, pinning down the QL. Right along through here. you her lower back and diaphragm right along.
See it defining right along that too.
I like to get an idea of what the invaders are doing. Alright, so after all that is set, I do a quick brief because what I do is split the back one side to the other. Alright, I'm going to pin right on her thumb pad. Actually, that's not too bad. Right at the
scaphoid hamate.
Right there. Yeah. And then right behind it, near the snuff box.
Yep.
Okay, and then I'm gonna apply some downward pressure here. So most of the pressure, this is just pinning that down, but most of the pressure is with my palm. That's where I'm holding her hand down. And I'm applying pressure through there. And what I do is I lock it into my hip.
For leverage, yeah.
For leverage, and just push down. And what that does is that it loosens up
supraspinatus
right in through here and then along through the thumb. Take 2 deep breaths. Now there's some rolling happening. There's some rolling happening right in here, but it's not going to completely release. This is just a pre-workout because the rest. Ooh, no, there we go. And then it also loosened up here. So with after that, I like to then get back to the QL because since that was tight, and then hold at the top. So just while we were doing the bottom, we're gonna hit the top right into there. And we're gonna roll where I am in the QL clockwise. I try to follow by what the muscles are doing because it already started rolling that way automatically. So I'm like, okay, that's where you're gonna go. That's where we're gonna go. And all you're doing is just guiding it. There's no use in fighting the body and what it wants to do. Some release here. We got some release here. Okay. And to get a feel of what happened and where we need to go next, do a couple passes, long strokes. So this is eased up. It's not as tight as it was before. A majority of it.
Yeah, I see that when you go over.
So, with that, then I'm gonna go to the good stuff here. I'm gonna lift up the arm, cradle it, thumb on the forearm, and then again, we got index finger by the humeral
epicondo.
There.
The thing that sticks out.
That word, yeah. And then the thumb along, well, not the thumb, the middle finger along there, and then the lower 2 fingers in the forearm. And I'm going to pin my elbow into the gluteus medius.
Gluteus medius, gotcha.
About right there, so right on the side. All right, and then what I'm going to do is I'm going to grab the forearm, kind of get an idea of where I need to go. I'm going to start off with the pinky, and I'm pulling down. I'm holding pressure here so that her upper arm doesn't move anywhere. I'm yanking the forearm and the hand down.
Yeah.
Grabbing the pinky. Now, I'm gonna hold pressure here. And just roll her arm. Roll her arm. And then if that doesn't loosen up, then I'm going to apply some rotation to the elbow.
Seeing some of what I'm seeing is what you're holding right here. I see it in the ring finger too.
Some more rotation here, and again, it's kind of like we did on the lower leg. Sometimes you have to do some rotations where you're holding, some rotations where you're pinning. So we're just alternating. There we go. There we go. And sometimes you have to alternate.
So at this point, you're basically creating a triangle.
Yeah.
Yep.
But we're getting there. Okay. Now, so you can see it's not as tight as it was when we. So then continue on with the rest of the fingers.
Yeah, that's what I'm seeing right there.
That one's loose enough. There, and this is actually getting better here. No, gotta redo that one. Okay. And the thumb, sometimes you have to, kind of how I picked up the hand and flexed.
Yeah.
Sometimes you have to do the same thing with the thumb, and sometimes it requires, what is it called? Rotation, outward rotation. So I'll just there, and then after I'm done with the forearm, done with the triceps, and do a broad stroke with the triceps. Sometimes they're tight and locked up. We'll work on that on the other end. Inner supine. But then I take the hand and apply pressure along the back. With my fingers in line with the spine, that we can kind of get a good view of what's happening. There's still some tightness right in there. But what we're going to do, we're going to skip that because we'll work on that in a minute. We're going to focus on the neck and relieve some of the pressure on the palm and the thumb, and then apply it more on the fingers. And then as we're rolling upward, we're lifting up the arm slightly.
Yeah, I see it. So you're getting that pull. Yep.
And then what we are going to do, and typically you can feel the tightness right to the scalenes here. And what you're going to try and follow is the jawline. Now, when you get,
This is the yawn part, right?
yeah, this is that part. I'm trying to find the edge of that jaw. All right. Now, what you're going to do is take the slowest, widest yawn you've got, and with these fingers, what I'm going to do is I'm going to rotate counterclockwise and roll off the corner of the jaw while they're yawning. Real slow, and then you're gonna have a couple, if you're lucky, you'll get a couple clicks and pops in there, but that releases everything through there, and you'll feel it releasing the forearm through here. And then I just run over everything again to kind of smooth the rough patches over. All right, now we still have the teres are still bad. Teres and lats are, but it's looser. You see?
Yep,
It's
I see
lot
that.
looser than what it was.
I see movement here. That
Yeah.
wasn't there before.
So with this part, I like to go ahead and take my palm and pin it right on the triceps.
Yeah, the medial head. Got it.
Take my fingers right into where the teres are. And I like, okay. We're gonna get up here first, and then we'll get this right here. So all that's doing is pinning here with my palm,
Yeah.
right in there. Let's see. And then we're gonna bring it upward together. Real slow. Now while we're doing this, both hands, because the muscles are getting a counterclockwise rotation, so we're gonna follow it right along the line here. I'm still applying pressure with my palm on her triceps. And here's a stopping point here. Take 3 deep breaths. This may be a pass on this part, and we're gonna have to take care of that with the anterior work. Slow wide yawn. There was some more in there. All right. Okay. We're gonna pass on that because this we can take care of.
Yep.
All right, so then I like to tack down the inner abdominal muscles. What is it? The QL. Oh man, no, I can't remember. And then start at the sacrum on the left side of the multifida, and then push upward while applying pressure. Now you will, when you do this, you will get to see some extra spots of tightness like that was right there.
Yep.
We're gonna continue rolling upward slow. Pressure at the crest of the pelvis. And once we get to the top, we come back up and roll over the scalene some more. You know, you want to, if you're trying to pop it but not pop it, so you're just getting to that breaking point of where you feel the tension and loosen up the pressure. And I think, yeah, there we go. That just released there. right in here. I'm gonna follow the.
Yep.
About right there for the pinky toe, and it is about there. All right. You feel this guy right there?
Yeah, I can see it when you go over it. Right about there, yeah.
So again, a little movements in the foot. It's a really slow crawl upward. Go back up. Yeah, there's still a catch right on the outer, because before I was deeper in, but you can feel it right here.
So that's external oblique then.
So now I'm rotating because I feel
Yeah, I can see you.
the foot rolling inward and the hip rolling outward. So we're gonna go opposite rotations here. And again, I'm not fighting the body. I'm just feeling for the natural rotation of where it's trying to release and just guide it along the way.
Yeah, I can see the curve right there.
You'd be surprised how much the pinky and both pinkies, the hands and the feet, how much they hold on to. Flop it over again. Pull, drop. That's pretty much it.
Lydia, wasn't that way easier than what we were talking?
Much. I'm implementing all the draping.
So, both hands underneath, cupping the scapula
Yep.
with thumb here right under the clavicle, and then my right thumb is right along the edge
That's a serratus.
of the serratus, right along the scapula. So essentially all I'm doing, go ahead, I'm gonna roll you over just a bit. So about right there. So you see where my hand, I'm pretty much bracing it and cupping it from this side right in through here.
Yeah.
So that I feel all of the lats. I have all the lats, the teres and everything right in through there. And I just bring it up just a bit so you see the space. It's mostly fingers. I just hold it up there for about 10 seconds. Normally, I pull toward me, but I like to just kind of ease off a little bit, just keep the pressure on, but just kind of lower them down a little bit, and then take the pressure off, and then bring it back up, kind of like I'm creating an artificial breath form. But in every little bit that I do that, I pull toward me. So that way it kind of separates the rhomboids. It kind of stretches those guys out. And it gives me an idea of what I'm having a battle here. So now when I'm getting ready to release, I spread my fingers out. So I'm in this position. and then I do this number. So that I'm running all along the scapula. And then I end right at the southernmost point of the scapula. And I end up pinching it. So I'm in this position, right at the end of the scapula. And I'm up here, and I'm doing the same thing, but up here I'm at the neck, into the scalenes and the levator scapula. And while I'm applying pressure there, I'm still pulling toward myself.
Yeah, I can see it. You're down at the inferior angle, and then you're up here. Yeah.
I'm still pulling, just slowly still pulling.
So that's the thumbs over the trap, and the index and middle are going to be where the levator is.
Yeah, and then that just released right down there. Yep, and there's another one. Now while that lets go. All right. So that's phase one. Phase two, go ahead and gripping the arm. Now, this is where the fun comes in because everything turns to jelly, hopefully after this. My hands scoop up. We're doing the same thing like we did on the back side. So we're gonna grip everything right through there. Thumb right there. And what I'm doing is with this thumb, I'm pushing that way toward the hand. Okay. Now my hand is still back in this position where I first started with the scapula, but right now it is right along the spine, on the middle of the rhomboids and trap. And all I'm doing is just shaking. Again, I'm still pushing with this thumb downward, and I'm just shaking. And what's going to end up happening is everything up here is going to end up loosening up, and so is everything here.
Yeah, I can see it through the clavicle too, anteriorly.
A little rotation. And we got a bit more. There we go. All right. And that loosens that a little bit more. Now we get to the hand. I start with the back of the hand first. I go through each finger, right in between and up. And then I go like this to separate right in between there.
Yeah.
And again, little by little, because some folks cannot tolerate it for whatever reason. But the folks that are like, you know, they know that this is vital, and they'll put up with it for a bit.
Yeah, I see it. A little diagonal going there.
Okay.
So that's from that ulnar deviation.
Yeah. So I gotta pull that thumb away, and that's helping spread it.
Yep.
And
I can see the deviation goes away when you do it.
Adam.
Probably, yeah. The gentler version of what I do.
Come on. You're almost there. Like it takes a lot of finger dexterity trying to get that going. And that's another thing, you need to keep the finger dexterity up. You play guitar?
Mm-mm.
I've always figured with doing this, I should be able to, but no. All right, that's not gonna loosen up there, so we'll get it over here. And the same applies here, except for you're gonna use your left hand this time and kind of go up through there.
This is more, it's flossing, but this is more rotation than just linear or horizontal.
This thumb is not happy.
Focus.
Trying to fan out. Go right into here. There we go. All right. Now, I just like to grab right along the wrist here. I like to lock it in place and then keep this finger along that track line. And with this hand, keep this finger out so that I can kind of feel what's happening. And then squeeze with these. And then go upward. This kind of gives you a broad clearing of the forearm. We're gonna get back to the forearm. That's just the general clearing of it. But we're gonna, once we get back up here, we're gonna mess with this because it's still rigid and tight through there. But you should notice that all this is a little looser. We still got some fight in here. Now, if there's still tightness in the bicep and in the shoulder, which there is going to be, now you see how this, everything in the leg is still loose?
Yep.
On the left side, I'm pretty sure that's not gonna be like that when we get there. And all I'm doing is I'm just feeling to make sure if I don't have to go back to the foot while I'm up here. I've had instances where folks are like, my neck is still tight, and it was. Now I did everything I could up through here and it was still tight. And then I end up going to the foot and it loosens up. So we're about, nope, it's gonna be abs, all right. So we still got a lock right in through here.
The anterior crust, yeah.
So with my hand still next to, you see where my hand is? You got the scapula right here.
Yeah.
I'm still right into it because there's some tightness there. And I'm getting, you got the
Anterior crest, the ASIS, all that, yeah.
right in there, thumb sliding right underneath. And I'm grabbing here, I'm grabbing here. Okay, I'm just shaking. Just a little shake. Because that is affecting the neck and the shoulder there. And I stop with that. I stop down here because I feel that this is about to release. And then I start up here.
Okay.
Okay, and then once I feel the hips try to start to release, then I stop here and I go vice versa. Now they're both at a tipping point, so I'm going to relieve pressure here. I'm going to ease off on the pressure. Yep, just keep breathing. You're doing great. And we got about 3 more breaths and this should release. 3. 2. So that's all loosey-goosey. Now, go with my hand here. I'm still cradling it right along the side because I want to make sure I have all of this cleared. But it gives me an idea of what needs to happen next. So I'm gonna move this hand lower. And still keep pressure.
Is your pinky mid or is it all the way down to the inferior angle?
So it's,
yeah, okay. Inferior angle.
So
Gotcha.
I'm crawling lower. Alright. Now, you feel this right here? Feel that? That right there.
Yep, right in the middle of the supra.
While my palm and fingers are there, I'm gonna apply pressure right on there. Okay, because feel this right here, just like that. So you got
Right below the diet, yeah.
Right into there. So this is kind of what I did to you, where
yeah,
that going on.
Yeah,
So,
right there.
Let's see. Take a deep breath in. There you go. Let it all out. Now on the exhales, that's when I kind of curl in a little bit more.
Yep, get your fingers in there.
Yep. A little more. Okay. Now on the sternum, we're going to ease off. Okay. Slowly release the pressure. Now, this is at its break point, and this is at its break point, so we're going to hold it there for a little bit. All right, 3. We're going to ease off slightly after each exhale. 2. All right, and this hand, my left hand's coming up. It's rolling along the scapula because it's loosened up. This hand is kind of smoothing over the rough spots there. There you go. Okay, now we have one more because this isn't completely done yet. Now what I like to do, especially with females, so that I'm not worried about the breasts or whatever, I make sure that I locate the lower rib and follow the diaphragm and the sternum right to the edge there.
Almost like to the xiphoid process.
I don't go past that at all. But I make sure that I keep but I use it as a guideline because
thumb's the pivot point to guide.
At that right underneath the rib cage, because you still want to get that, because the whole point is to get with the deep breaths, is to get the diaphragm loosened up. So in order to do that, you keep your thumb right along the lower rib cage, and then put the middle finger, or whichever finger's the longest, right along the end of the sternum there. Now my hand's moved
back upwards.
Back upward. It's essentially my middle finger is straight underneath here. All right, now that middle finger's crawling upward the neck. Still applying pressure here. Now take 3 deep breaths. And after every exhale, I'm applying more pressure in the sternum and the rib cage while I'm sliding upward.
Can I feel where you are in the sternum?
Yeah.
Okay, so right at the beginning of the body.
Yep, right at it. And that hand is slowly moving upward while still keeping pressure here. And it's not enough to take, it's not taking their breath away or anything like that. It's just enough so that you feel that muscle easing up. And we're almost there. There we go. Now we got a little turn. It's snapping right up top. Oh. You see where I'm ending up?
Yep, that's where that adhesion was when we had her.
Yeah, I mean, it's locked in there, so just keep breathing. You see where my right hand is? Her body, essentially with every breath, it's been rotating inward, so I'm just going with it. I'm not fighting anything, I'm just going with it. I'm applying pressure. And we're almost set. There we go. All right. We're not done there yet. That next one's gonna work. So, hand back, okay. Hand back on the edge of the clavicle, that seems all loose. I'm just gonna do one quick real shake here. All right, that done. Now let's focus up here. So with the forearm, is there still some tightness in the bicep? I like to take the forearm, just rest it right across my hand here. My hand's still right along. Now it's closer to the spine. Right along through there. What I do with this hand is I grab both sides of the forearm. Just keep pressure on it. While you're raising up with this hand, keep pressure here. I'm pulling outward, and it's releasing here.
Student clinic.
And then the bicep is a little looser, but that's still coming from the upper pec.
Yep.
Right into there. Okay. Last bit. If your hands can, there's still a little bit here. There we go. All right, take my 2 fingers.
Yep.
I like to pin it right down the middle. You see the pads, I like to split.
Yep.
I try to dig down and spread out. And then whichever side it chooses more, that's what I go with, because that's typically the side that is. So right now we're gonna roll on the thumb side. And apparently that pressure point helps loosen up. Ooh. Deep breath. Let it out. Helps loosen up the lingering muscles. If I need to chase it with a follow-up, I will. Biceps loose. There's still some right over there, which I just take my elbow, pin it right in here. Just give it a little shimmy and go up and out.